ask. I wanted to quickly just ask about, and perhaps the doctor can answer the question, is there collaboration between, I know because I worked in Manitoba Health in northern Manitoba, and there was a difficulty between Health Canada in terms of the nursing stations and the provincial system actually cooperating and working together, because ultimately, like a regional chief Day said, we can't work in silos. We need to work in partnership, and the care has to be continuous, whether the patient moves from a First Nation community to, say, Thunder Bay Regional. So has there been good cooperation with Health Canada, or has that been a problem?
I would say I've seen a lot of siloing of care, right? There's clearly, and that is a huge issue in our region and stuff, you know. That is a huge issue in our region. The fact that, like for example, looking at child development, you might have some aspects that are covered by the provincial system, but who is going to fund the travel? Right? So ultimately, like, how are you going to get that child care? That's what care is about, right? It's getting the right care at the right time in the right way, right? And sometimes it just seems to me that you know, you have these two systems that are operating, and they're not talking to one another as effectively, and they're not focused on putting the child at the center and say, how are we going to get the child care? Right, and that's where you get this these huge jurisdictional challenges.
I'm afraid we'll have to leave it there, Dr. Kirlew.
Okay.